Hello everyone, I'm Dr. Rishikesh. I'm a radiation oncology resident at Kidwai Memorial Institute of Oncology, and this video is for those who are confused as far as the Neet PG 2025 counseling goes. Is not for those who have a particular branch fixated in their minds and they're passionate about a particular branch. In that scenario, if you're getting the branch of your choice, then definitely go for it. If you're not getting that branch of your choice and you're definitely passionate about a particular branch, take a drop. It doesn't matter 1 year, 2 years down the line, because you will be carrying that branch with you for the rest of your life. For those who are a bit lost and are confused how to go about the scenario and they don't have a particular branch in mind, this video is for you. But before telling about that, I'd tell about the sources which you can go through as far as the counseling is concerned. Since the choice filling and everything is started, you must have definitely registered for national as well as state counselings, whichever you are registering for. The sources that I used were Zynerd. The Zynerd app is really good as far as the cutoffs go, the allotments go. Apart from that, you'll get the bond related details of various counselings. You'll get to know about various open states. So suppose you're not going to get a government institute or not a DNB institute, there are certain states in the country, such as there's Karnataka, there's Telangana, there's Rajasthan, there's a few other states like Bihar as well, Uttar Pradesh. So in those states, out of state candidates also can participate in the state counselings. So you can go through them as well, which opens up a few more options. So that is it about Zynerd. Zynerd YouTube channels is also good for videos related to how to register for counseling, how to do the choice filling, and so on and so forth. Apart from that, you can register to Muzaffar Khan's Telegram channel. It gives all the various updates related to Neet PG counseling. And apart from the same, one thing is Gaurav Tyag's YouTube channel for various updates as well related to Neet PG counseling. Yeah, he keeps updating like weekly. He'll put 2-3 videos and so on, and I found it good. And apart from that, a few career related videos I think are good on Aditya Gupta's YouTube channel as well. So I guess this sums up all these sources. Apart from this, there's I guess one more source, especially for those interested in the DNB counselings. You must know that in the first round of counseling, not all seats are approved. The seats get changed with every round, and for that you have to look at the DNB accredited seats for that year as far as the counseling is concerned. So there's a DNB website on which you can get the latest data of the DNB accredited seats for DNB as well as NBE diploma, and which are in process, which are approved. You all can get that data. Also, when you're suppose you know the branch you want and you want to talk to residents and but you don't have any contacts whom to approach, so NMC gives a list at the end of counseling. So like last year's NMC published a list of 2024 of the data of all the candidates who have taken up admissions last year, and you can like you'll get the names, and from that through various social media channels like whether it's Instagram or Facebook, LinkedIn, you can approach the various residents and basically get an idea about the various institutes, because you cannot practically go to each and every institute which you are going to apply. So from that you can get those contacts. Now the sources are done. Now let's come back to the decision making process. So when we look at the decision making process to select a particular branch, what I feel that one must do is two things you have to look at. One thing is the long term prospect, that what you want from your life. Secondly is the short term prospect. What do you mean by short term prospect? A short term as in daily how you want your life to look like. I mean, whether you want it to be filled with work, whether you want to be filled with administrative responsibilities, whether you want to come back home at 6 7 o'clock, or whether you are okay working in nights, working like in the peak of your career. During residency you'll be working day and night, obviously, whatever you choose. But afterwards, whether you're okay with a sort of unplanned life or whether you want it to be structured, all that should uh, take precedence while you choose a branch. And you should not say it just because you are enthusiastic at the moment. You should basically write down and analyze yourself, take a day or two to understand what you want from your life in the daily setting. Then in the long term setting, you have to see whether you want to have an academic life, or you want to do research, or you want to just see patients clinically, or you want to do, or you want to earn lots of money, or you want to own a hospital, you want to own a clinic, or what do you want from life exactly in the longer picture. This may change along the way. Okay, the short term thing, like the daily aspect of things, I think plays a more precedence, because that is what you will be doing day to day, and day to day, if you're happy doing what you're doing, eventually life will sort out for itself. The long term picture may change based on whatever you take and whatever obstacles you go through in life. It will change, but the short term, like the daily thing about the branch, would not change. Then once you decide these two, then I suggest that analyze at your rank. Now you have a particular rank, so based on the rank, at that rank, which all branches are possible for you. There's no point in saying that you have a 80,000 rank and you want radiology in a government college. It's not going to be feasible and practical. So, and if you're passionate about radiology, then maybe go for another drop. But if you don't have any such thing, then in that scenario, see what all branches the people have got. Keep a margin. Don't be like at 80,000. Some branch closed at 79,000 for example. So it's not or let's say your rank is 10,000, some branch closed at 9,000%, and your rank is 10,000. So you will not go for that branch. Don't be like that. Keep a margin of around 5,000 up, plus and minus for each branch. So those will be the branches that are possible for your rank. Now, once you get that range of branches which are possible for your rank, then you have to sort of shortlist them into three categories. One is non-clinical. Now, non-clinical branches, most of them don't go for it because there's no glamour attached to it, and it's not a path that the majority people want to traverse whenever they enter MBBS. We enter MBBS because we want to treat patients, which is not going to happen if we take a non-clinical branch. However, pathology, it forms the cornerstone of a diagnosis, and eventually you can do an entrepreneurship, you can start something of your own if you do pathology. It's a really, really good branch. Then there are other branches, like even anatomy, people are doing 3D models, helping the various uh, apps being formed for even surgical these things. There are certain surgical animation videos for training which are being developed, and the anatomists play a huge role in that as well. For example, training of robotic surgery and so on, and even for 3D diagrams and so on. So anatomy plays a crucial role, and those people are also earning a lot. As far as, along with that, obviously need PG coaching and academic this thing is there only. So don't totally neglect the non-clinical options. Okay, but if you're okay, you want clinical only, then in that scenario you can go for three types of branches. So one is a purely medicinal aspect, such as whether it's general medicine or other branches which have only OPD basis, and there's not much procedure at, like at the MD level. You might go DM and then do interventional stuff, but at the MD level there is no surgical or interventional aspect in it. Then secondly are your totally interventional branches, such as surgery, gynac, even ophthalm. Ophthalm now is a mixed branch, but however, these procedural branches are there. And third is your mixed sort of a branches. Mostly mixed sort of a branches are super specialty branches, such as interventional radiology, interventional cardiology, and so on. Radiation oncology also comes in that aspect. So once you decide what you like among that and what you want from life and the branches that you are getting at your rank, then I'd suggest you at least shortlist it and come down to 2 to maximum 3 branches. Do not go beyond 3 branches, I feel, because that means that you're not actually sure with anything that you have decided. In that, don't enter counseling in a totally chaotic mindset. Yes, the exam is important, but the counseling aspect is equally important because it will decide the career you're getting into, and that career most likely will last a lifetime. So don't gamble with that. Shortlist at a maximum 3 branches. Best option would be to shortlist 1 branch. However, if you are finding it difficult, 2 would be good enough. 3 is okay. More than 3, I'd say, is not really a good way to go about things. And then there'll be some people who are not liking the clinicals, not liking the non-clinicals, and they want to explore further. In that scenario, there are certain branches such as sports medicine, which is good at Safdarjung. This space medicine, which is there, aerospace medicine, which is there, which are totally niche branches. And if you do well in these branches, I mean, then you can really be successful in these branches because there's not much competition yet. And I guess these are very niche branches and you can enjoy it if you're not okay with the normal set of branches that we have. So I guess this is how you can sort of shortlist what you want. And once you decide, like suppose you decide 2 branches, then in that, don't be like good colleges from one branch, then good colleges from another branch, then okay colleges from the first branch, okay colleges from second branch. The branch should take precedence over the institute, because the branch is going to last a lifetime. The institute will last a few years. Yes, the skills you learn in that institute are important, but the lifelong what you learn will happen in that particular branch that you take. So once you decide the branches, shortlist them in a hierarchy. Put that first branch from good to bad, then followed by the second branch. Now, okay, now how to get knowledge about the various institutes? Like I said previously, there's a list released of the residents who have joined the course last year. Those people you can contact via the like various social media channels. Then apart from that, whichever institutes is feasible to go, please go and visit. I know there's a very short span of counseling remaining, like till 4th or 5th, so it's like barely 3-4 days. And like if you right now don't have an idea about a particular branch, max to max, and if you want to know about it, go to a couple of hospitals within your vicinity, one corporate, one government. Talk to a few people as much as possible. If you're okay with it, try it out in round 1. There's always an option of free exit in round 1. You can join that institute, see it a few days, because there'll be a gap till round 2. If you're liking it, good enough. If you're not liking it, you can always opt out. And I guess that's it from this video. All the best to everyone for the counseling season. I mean, I know it's been a very challenging journey for everyone. The whole Neet PG process every year is very arduous. There are many rounds. And if anyone needs anything, you can reach out to me on my Instagram page. And apart from that, if anyone is interested in radiation oncology per se, you can reach out to me on Instagram. If you want me to make a video on the same, I'll make one regarding the same. I'm just 7.5 months into the branch. I'm enjoying it, but I don't have like the full picture. Whatever I have, I can give it out to you, to those who are interested. All the best once again.